So we'll talk a little bit about the background and why we thought doing this study would be important. Next slide, please. So we knew well before the pandemic that we had been doing research with families, and I, as a practicing psychologist in the province, continue to see families regularly. And so we knew that families of autistic children are at risk because of the many challenges that they face on a daily basis. For one, we know that autism often affects social communication and interactions, and generally it affects one's relationships. And this is no less true in family relationships. So often family relationships may be strained because of the many challenges that children or family members face due to autism. Often also more than one family member is affected by autism, and likely also in different ways. So it's challenging when you have more than one child or more than one family member with autism that is requiring different sorts of needs. And the severity of autism doesn't always reflect the level of need. So I'll give you one example. A child may be nonverbal, but able to use a communication system quite effectively and actually have their needs met pretty well. Whereas in another case, you might have a child who is quite articulate, but the way that they speak to other people or members of the family and the things that they say to family members may be quite frightening or quite hurtful. And so it's difficult sometimes to say that one family is more severe or has more intense need than another family based on just one aspect. We have also a great deal of knowledge about the various services, the therapies that are effective for specific issues that autistic children and even families face. But we have less understanding about how to match those services to the family's needs, because the needs can be quite different from one family to another. And so this is a challenge often for many professionals. So when COVID began and then restrictions were in place, we knew that families of autistic children would be among the hardest hit. So we worked really quickly with our partners to reach out to the community of families here in BC to hear directly from them about how COVID restrictions were impacting their families. And so now I'm going to turn it over to Vanessa, the lead researcher on this COVID study, to tell you more about the rationale and also the findings that we can later discuss. Vanessa?
So before the pandemic, some of the research at our lab was aimed at understanding quality of life and service navigation in families of autistic children. So this gave us an idea for how families were functioning and their quality of life before the pandemic began. So Emily Gardner, a former PhD student of Grace's, examined family quality of life in families living in BC and found that specific characteristics of the child, specifically their adaptive functioning abilities and the child's behavioral problems, significantly impacted the family's quality of life. So this informed some of the items on our survey. And knowing that these factors were predictive of family quality of life, we then included measures of child behavioral problems and some adaptive behavior skills on our survey to assess. And then building on Emily's thesis, my dissertation takes a community engaged approach. So I partnered with Bo-Sang Lee, a panelist here, to explore family quality of life in Korean families, a culturally and linguistically diverse sample to try to understand the barriers and facilitators to accessing autism services in BC. And this is still ongoing, but what we've seen so far is that even before the pandemic, families from this culturally diverse community, while there is a lot of resilience, resourcefulness, and strength in this community, many parents still face substantial barriers trying to access diagnostic and other services for their child across the lifespan. So another focus of our survey was assessing service and support needs. So now I'll just talk a little bit more about the context of our study. So we decided to do this study because we recognized in our consultations with community members, especially Deborah Pugh, who works right on the grounds and hears directly from parents and receives calls from parents. We became aware that families were struggling immensely during the lockdown period. And the few supports that were available were not only insufficient, but they were placing parents, their sibling, the child's siblings, their whole family at risk in terms of safety and their mental health. So it became clear that service gaps that existed prior to the pandemic were magnified and made worse in light of COVID-19. And this had to do with school closures, parental employment changes, social isolation, and most importantly, a loss of essential services. So we decided that the best way to conduct this research to ensure that we were asking meaningful and important questions was to take a community engaged research approach. And I'll just talk about what this means. So community engaged research is when partners contribute expertise and share decision-making and ownership to increase knowledge and understanding of a phenomenon and integrate that knowledge with interventions, policy advocacy, and social change to improve quality of life for families, for communities, and to reduce health inequities. So in other words, community engaged research involves collaborating with members that belong to the community that you're studying in actually carrying out the research. So our partners were involved in the design, the implementation, the analysis, and recruitment stages of our study. So they're no longer participants, but equal partners or co-researchers. So why do this type of research? So there are numerous benefits to both the community and researchers. A benefit to the community is that they're able to generate knowledge that their community needs. They're actively involved in determining the research questions, and they get to have a say in decision making and in setting the research priorities. There are also benefits to the researchers like myself. So by working with communities right at the beginning, this helps increase the likelihood that the research you're doing is relevant and will have a positive impact. And because the knowledge that's generated is more likely to be relevant because you've collaborated, this can help facilitate and expedite the knowledge translation phases of the study, which we'll talk about at the very end. So moving our research findings to practice, moving our findings to the community and to people impacted. So for this project, we partnered with Deborah Pugh. As you probably already know, she's the executive director of ACT. So we partnered to design and conduct this study. And because she works very closely with caregivers and families, she was able to help us identify research priorities in her community. And she, along with other community partners, helped in formulating our research questions and our objectives. Deborah helped co-create our COVID-19 survey along with other parents and autistic individuals in the community who provided their feedback. And we also consulted with researchers at the National Autism Research Center of Israel, as well as another lab in the education department at SFU. So her feedback, along with our other partners on the various study documents, including the recruitment flyers, the advertisements, and her relationships that she's established with the community, I think that this really helped increase the number of participants that were recruited to our study. And lastly, Deborah was involved in the knowledge translation phases of our study. So what we're doing right now, moving our research findings to the general public, to parents, and to the community. So knowledge translation is a really important aspect. There is a gap in moving research evidence to practice, and one of the solutions to bridging this gap is to take a community engaged approach. So that's exactly what we did. So now I'll just talk about some of our research questions. So again, in collaboration with Deborah and the community, we were able to formulate our research questions. So our first research question was, what is the impact of COVID-19 on the child, caregiver, and family? Our second research question was, how does family quality of life differ before and during COVID-19? We were also interested in exploring what our family's service and support needs were. And our last research question was, what are the characteristics of the family that are linked to improved family quality of life? So in other words, what do resilient families look like? What resources and coping skills do they draw from? So now I'll just talk about our research methods and our sample, so who took part in our study, and also some of the measures and materials that were used. So here we have a table with the various sample characteristics. In the first column here, you could see the different characteristics that we assessed. So who the respondents of our survey, who they were they mothers, fathers, grandparents, and the corresponding frequencies and averages in the second column. So it's important to look at who completed our survey to make inferences regarding the generalizability of our findings to the population. So in other words, is our sample of caregivers that we surveyed representative of this general population of caregivers raising autistic children in BC? So the majority of our participants, almost 90%, were mothers. The mean age of caregivers was around 43 years old. Their children that they reported on were on average about 10 years old. And the majority of the children identified as male in gender. And the median household income was between 80 and 110,000. This was their annual income, which is slightly higher than the national average, but comparable to the BC average of 85,000. So the standard of living in BC, the cost of living is higher than in other provinces. So this reflects that, our sample reflects that. In terms of the ethnic background of our sample, about 17% were categorized as non-white. Oh, and I should also note that these specific characteristics that where there's an asterisk beside them, we collected this specific data for 126 caregivers only out of the 238 total. So we began collecting data in July through September, asking parents to report on outcomes that occurred during the initial lockdown periods. We asked them to report on outcomes that occurred during March, and we assessed child and caregiver outcomes related to their own and their child's sleep, their child's behavioral problems, and both the caregiver and the child's mental health. And one of our main outcome measures was family quality of life. And we assessed this using the Beach Family Quality of Life Scale, which we'll talk about in more detail in a few slides.